I'm Liz Rickard, and I'm with the Illinois Balanced and Restorative Justice Project in Illinois. And I'm here at the Art of Hosting in Illinois in May of 2010. And we're collecting stories from participants about their work with youth. And as we had our first event on the first evening, June was telling me about a program that she had participated in for several years in Kane County, and it was called SHOCAP, and I was fascinated and I wanted her to tell me more about it. And so we were going to capture this and share it with all the participants of the Art of Hosting. So I'm going to just turn it over to June and let her tell me about it.
Okay. SHOCAP is was a program to target youth who were at risk of being removed from their communities, either through going into incarceration, mental health facilities, or alternative schools or expulsion. My referrals came in from police departments, probation officers, community people as well, and churches who had relationships with these families and children. What we provided was an intensive in-home case management, where the first interview with the entire family was held in one of our offices, and then second interview and on were held in their homes. Mm-hmm. The first 2 months was a weekly 1-hour contact. The next 2 months, if there seemed to be some buy-in by the family and we were maybe seeing some changes at some level for somebody, it was then every 2 weeks. And this program went on for a year with, at the 6-month period, the meetings being once a month. We provided community referrals, we advocated with, we provided the telephone for mom to make that phone call sometimes for things and services that they needed for the children or the family. We addressed everyone in the household, not just the targeted child. With the belief there was that if we change the child but we don't change the environment that they came out of, or give them something, skills, information, referrals that they can make some changes, the kid's going to wind up right back where he started. So that's how that program ran for about 9 years in Kane County.
And was it a funding problem?
Funding was everything, yes. It was a funding problem.
And you were also telling me that this was a mandated program, or it's in the juvenile code.
It's in the juvenile code. It's SHOCAP, SHOCAP, stands for Serious Habitual Offender Comprehensive Action Program. Mm-hmm. Now, that title makes you believe that all these kids are just one step out of jail, and in some cases, some of them were. And the different programs throughout the state that had them, with our program being based on a program in Denver, I believe it was, and then the program in Decatur. So we combined what those two programs were doing and made our own and developed our own program. In some counties further north, they use the program just to gather information and track some of the juveniles. Okay. Whereas we did that, but we tracked them to identify them who could use services and then provided those services.
Sounds like a very effective way to deal with the family system, not just the problem of the family.
Yes, yes. Had a lot of good contacts with social workers in the schools and in the community and agencies who collectively we used a modified wraparound process so that we were trying to bring, with the family's permission, with authorization, to bring these people to the table to also help support the family. So when I was gone, the family still had support and guidance to do the things that would make them healthier.
Right. And is there anything happening in your county like that now?
Not that I'm aware of.
Not a whole personnel or a program.
Not that I'm aware of.
Unit. It's not a unit anymore.
The part of the problem was, again, with funding it, because you spend so much time in the household and traveling from point A to point B, it's an expensive program.
Okay.
So even though probation used us a lot and was part of our steering committee, as well as the diagnostic center, state's attorney's office, Public Defender's Office, Regional Office of Education, our main mental health units in the county. They were all part of our steering committee.
Wow.
But money to fund it, it was not there. And the staffing to do that was not there.
I have two questions to kind of put it in context. This was a program of what agency?
King County State's Attorney's Office.
Is that right?
Initially, it started in the State's Attorney's Office because we were in the household with the families. There were times when things were happening that I needed not to know about, so I would step out. But also in conversation with the families, there were things that I would hear about. And in some cases, these children did have pending cases, as well as other household members. So we began to see the conflict of interest. So at that point, the program was moved from the State's Attorney's Office to the Health Department as a community health issue.
And then what were the years, the 9 years, or the beginning and end dates, approximately?
This is 2010, so I'm going to say 2005 was an end date. So we would have been talking 97, I believe.
Okay.
90, might have been, okay.
Close enough.
Yeah,
Close enough.
that range.
Yeah. So it's for me, that's very educational. I'm in probation in a rural county, and we try to, through our Juvenile Justice Council, build that same kind of coverage for a youth. And we're doing it at the beginning of the police contact in any community. We have a uniform contact information document that the state's attorney then uses, and then that social history is created from that takes in all that collaborative information, service providers, schools, medical, if that's the case. So
we had that process as well,
and
our intake. When I first met with the family, that was our intake. And we did the social history if there was none, because some of our kids, well, all of our kids did not have to be referred from the police department.
Right.
So some of them had not had that police contact, or at least not to the point where the police were really engaged with them or the family. So we tried to get them before they got there, with the goal of keeping them out of that system.
Right. Thank you so much for your time. Is there anything else that I haven't asked that you'd like to share about your experiences with that? Put the money in the program.
I absolutely thrived on that program. I walked into households. We did some basic things, like I would ask the kid, everyone in the household, again, with those first couple of meetings, what is it that you'd like to see different going on that you think may be a positive influence on you changing your behavior? And I never forget this. This is a big 14-year-old boy who told me, I want to sit down at the table and have a meal with the family. His mother cooked every single day, and she cooked for an army. But she left it on the stove, and you went in and ate as you chose. So it took her a while for me to, in inviting her to sit down at her table, pull the table from against the wall, let's put the chairs out there, and let's all sit down. And it took a while, but she did buy into that and gave me a chance, and everyone else loved it. Wow. It still took her a few more times to I think, feel comfortable with that process. But the family loved it, and I think they did continue it. And actually, another family has called me. I've got 2 or 3 families that still call me from time to time. I'm still at the health department, and they can contact me there. And from time to time, Miss Joan, how have you been? So-and-so's graduating from high school, or so-and-so's had a baby. But my friend, she needs this, and how do I tell her to do that? So some of them have sort of become advocates for their family members and friends to a degree.
That's a great testimony to a good program.
Yeah.
Thank you.
Thank you.
How long was it? We can talk.
Look, how do you, that will be the button.
You think? It looks like your